Welcome to Cut the COVID Crap Part 26. Germany aspirating and comparing the vaccination mandate to kidney donating mandate. But first of all, let's take a look at the weekly data from the UK Health Security Agency, their COVID-19 vaccination surveillance report. The link in the below in the description. As usual, page 4 shows the percentage of the adult population having antibodies, which is 99.1%, so only 0.9% of the whole adult population doesn't have antibodies, and 28.6% of the population have antibodies from infection alone. They recovered from COVID before. So conclusion, if you divide 0.9 over 28.6%, you'll see that only 3% of the non-vaccinated population doesn't have antibodies. So if you have a random non-vaccinated person, then at least there's at least a 97% chance that he has antibodies, and maybe he doesn't have antibodies but has a good B and T cell levels. So anyway, compare those. So remember, roughly 29% of the population not vaccinated, of the adult population. This is out of the blood donor sample. So compare that to official reported levels. I think roughly, what is it? Around 80% of people of the population in the UK is vaccinated. They say. Anyway, between 20 and 29% vaccinated. Compare that to the to page 40. Yeah, page 41, 41, 42, 43. You'll see that of the new reported COVID cases, 9% of them are amongst the unvaccinated. So 91% of the new cases are vaccinated, 9% of the non-vaccinated. Last week it was 10%, now it's 9%. So it keeps on going down. Same thing for hospitalizations. Last week it was 17% in the unvaccinated group. Now it's only 15% of the new hospitalizations are in the non-vaccinated group, also going down. Looking at deaths, similar. Last week it was 13% of the new deaths were in the non-vaccinated. Now it's 11%. So the percentage of the non-vaccinated getting COVID, going to hospital, or dying is steadily going down. Does it mean vaccination don't work? Nope. It means that natural immunity works. But anybody saying it's a pandemic of the unvaccinated, complete nonsense. Anyway, the title, Germany aspirating and comparing vaccination mandate to a kidney donating mandate. First of all, the good news, Germany aspirating. So after 2 years of COVID, finally Germany has updated their protocol for administrating the COVID vaccinations. They um, recommend, or they enforce, I don't know to what level they do, but at least it's officially recommended that they aspirate. It's late, but at least it's one country coming to their senses. So hopefully other countries will follow soon. Denmark is doing this already, and I'll talk more about Denmark in a minute. Other thing, um, you know, comparing the vaccination mandate to donating kidneys, I was thinking, there's plenty of governments that, especially in Australia, that they don't mandated for children, but they strongly encourage children to get vaccinated. Also, the boys, the young boys, um, uh, that includes the young boys as well. And there's plenty of studies that show that young boys have a high risk of myocarditis. Or sorry, I shouldn't say high risk, relatively high risk. I mean, 1 in 2,000, 5,000, you name it, depending on the type of vaccine you take it and the interval. There's more on the second than on the first one. Anyway, risk benefit for young boys, talked about it before. Um, uh, Maybe 1 in a million of dying from COVID, maybe 1 in 2,000 of getting myocarditis. I'm not sure which one you'd prefer, but that's an individual choice. The argument is put forward regularly, but you have to protect others. So you want young boys to take a risk for themselves in order to protect others. Well, ask those people if they're willing to donate a kidney. Why not? I mean, you can live on one kidney and you can save other people by donating a kidney. You you help others more than it's bad for you. So why not mandate that? I really don't see a difference between those two. If you think you save more by, I mean, to me, it's questionable with an endemic disease like COVID if you're actually gonna influence other people. I mean, people are gonna get COVID anyway. They're gonna be exposed to it anyway, unless they lock themselves up. So the behavior of other people uh, doesn't have any material impact. But anyway, even if you think so, yeah, then yeah, I would tell those people, donate your kidney. If you have two, donate one. You help other people, and you'll survive on one kidney. Why not? Try it out. See what people really stand for. Lastly, Denmark. I'm glad that Denmark uh, was taking the lead in terms of uh, um, getting rid of all COVID restrictions, and you'll see that the Denmark the out of the total population, how many have had COVID? 40 something percent. I'm quickly gonna take a look. Denmark, where are you? 44% of their population has had COVID. If you maybe some of them are double counted if they've had COVID more than once, but anyway, 44% of the population, um, and their death rate is normal. Apparently, hospitalization rate normal as well. If you look at um, the history, I mean, you got up to maximum, I think, 5% of the whole population per week getting COVID, whilst the restrictions uh, were released. Now it's maybe like 3% of the population getting COVID every week. Still, one of the highest in percentages in the whole world, but they can cope. Apparently, they can cope. It's mainly it's 100% Omicron, almost 100% Omicron, and it's the vast majority is BA2 actually, the bit more contagious Omicron variant. Um, in terms of how severe it is, uh, not not significantly different, I think, from what I've read. If you look at the daily deaths, it's uh, uh, it's comparable to the Delta peak, but bear in mind now 3 to 5% of the population gets COVID every week. That's a really high number. In the Delta peak, there's not even close to that. But back then it was a Delta peak. You had maybe daily cases of maximum around. Let's see, the maximum of 4,500. That's like tenth of the recent of the recent peaks. So um, look at Denmark, same disease. They relaxed all the rules, and death is nothing extreme, and the hospital scope. Other countries should learn from that. Pass on the message if you can. See you next week.